For this video, I'd like to focus on filtering the master list of unscheduled treatment patients using the filters in the upper left panel that you see here. If you haven't seen the video where I go over the entire master list here, which is everything that you're seeing on this window, I would recommend going over that video first and then coming back to this video. Because for this one, I'm going to focus on this area here. So by default, as I said in the previous video, by default, you're going to see patients here that have pending treatment, which has been treatment planned in the last 6 months. Okay, so if you wanted to, you could change the date here either by entering it manually or just scrolling through here. Okay, and changing the date from and changing the date treatment plan date to. Okay, this is reflected directly from Open Dental. The general rule you do have to remember is you can go back as far as you want, 2018, 17, however long. However, the general rule is that this date range cannot be more than 1 year. The difference between these two dates cannot be more than 1 year. All right. Now let's look at this filtering by plans. Okay. So here, as it says, you can filter by patients. Hey, I just want to see MetLife patients. So you can add MetLife. But one thing to remember is if you have duplicates within Open Dental, it's going to show up like that here as well. Like for example, you see that Delta Dental shows up multiple times. Okay. If you type in Delta Dental, let's say Delta. All right, you see Delta Dental in New Jersey is coming up multiple times. So I'm going to select all of them, okay? So Delta Dental New Jersey and also this one. All right, so I want to bring up Delta Dental in New Jersey and MetLife patients because let's just say, hypothetically speaking, they happen to have the highest fees for my practice. So I'm just going to use those patients first and apply filters. And then I would only see MetLife and Delta Dental of New Jersey patients, okay, who have something treatment planned within the last 6 months. Always remember, I'm working off of test data, so my list is super short. But if you're working on your on your real data in the office, you're going to have lots more patients here. Okay. If you need to remove an insurance plan from this, you can just click on X. Okay. Or if you, as you're scrolling, like if you see red, that means it's already selected. So if you click it again, it'll remove MetLife from there. Okay. So those are just general things you have to remember. If you needed to search by, you don't have to scroll through all of them. You could just start typing in the first few letters of something, let's say Horizon, and that comes up right away. Let's look at filtering by codes. Like for example, if you look at I would like to bring up patients who have something treatment planned in the last 6 months, but the codes need to include any implants. Like for example, I can type in the word implant, okay, because I don't know the exact code and you can actually look through it, okay, but I know it's around 6010, so I can look through and it's selected, okay, or you could just type in the code directly, D6010, it's auto suggest, which means as you type it brings it up and then there it is, okay, so that'll bring up any patient that have an implant code treatment plan, and I'm going to go ahead and apply filter. Again, being a test machine, I have very few data. So I have one patient that's, that has something treatment plan, that has an implant treatment plan already in the last 6 months. Okay. So then I would, whatever you want to do, you could select it, add it to an existing list or create a new list, etc. In this case, the green icon means that this patient already belongs to a list, all right, which I've created. All right. So now I'll come back to list creation in another video. And you can select more than one code here. You could also say, hey, I would like to show patients that have something treatment for the last 6 months, also implants or any bone grafting. So let's say 7953, and then it would bring up patients who have either of those codes treatment plan, either implants or both, or either one, and just hit apply filters. You always have to remember to hit apply filters. Okay, let's remove that. And now this filter here, it says, hey, I want to see patients who have a certain dollar amount remaining on their insurance. You don't have to enter the dollar sign. You just enter the actual number. Okay. And there we go. Apply filter and it would bring that up. Okay. All right. You could enter any amount that you need here. Providers. Again, in my practice, I'm the only provider there. Because you're looking at unscheduled treatment, it's going to look at doctors only. So if you have a practice with multiple doctors, you could select one or more providers and then hit apply filters, and you would see all of them. By default, it's only going to select the default provider, which is set up usually to be the owner of the practice. But if you have an associate, you could, let's say, close that out, and you could select. Yes, you could select the associate and hit apply filters, and you would see only that doctor associate's patients. And then what you could do technically is select this button here and then say create a new list. You would add, you would create a new list for that provider. Okay, and again, list creation, I will come back to in a separate video. But that's pretty much it for this video. I just wanted to talk about these different filters and see how you can use them. Hopefully this was helpful, and continue watching other videos in the unscheduled treatment category.